Have you thought about what you'd do if you ever walk into your very first code blue? Welcome. This is NCLEX Prep 2.0. Like and subscribe to show your support. This is you walking into your patient's room on your first day of orientation as a nurse. Mrs. Smith is laying flat on the floor. First things first, safety. Make sure the scene is safe before you approach the patient. We don't want you to be the next code blue. After verifying safety, approach the patient and check for responsiveness. Tap them on the shoulder and tap generously. Yell out their name. Mr. Smith, Mr. Smith, are you okay? If Mr. Smith is not responding, activate the emergency response system. Call for help. While help is on the way, quickly assess for breathing and circulation at the same time. One finger on the carotid artery to check for pulse, and eyes on the chest to assess for regular chest rise and fall. You only have less than 10 seconds to assess for breathing and pulse. If it's a code blue, it could be either you cannot feel a pulse, or you feel a pulse but it's very faint, you can barely feel it, or you do not see any regular chest rise and fall, or the patient has agonal breathing or is gasping. Immediately initiate high quality CPR. 30 compressions, 2 inches deep, and full chest recoil at a rate of 100 to 120 chest compressions per minute. During a code blue, the order of interventions become circulation fast and airway breathing. In this scenario, you're in a hospital and so it's obvious that help is nearby. If you're in a place where there's no help, you will do 30 chest compressions and alternate with giving 2 breaths until the help arrives. Okay, help has arrived, the crash cart is here. The next team member can use an ambubag to ventilate the patient as compressions are going on. Do not stop compressions. To open up the airway, use the head tilt chin lift method, or use the jaw thrust method if you suspect a neck injury. A patient could have a cardiac arrest that is shockable or unshockable. Once you have your AED, open it up, attach the pads on the patient's direct skin. Do not attach on the gown, direct skin. Turn on the AED and continue with compressions until the AED says analyzing rhythm. When the AED says analyzing rhythm, stop CPR and give AED time to determine if this is a shockable rhythm or not. If it's a shockable rhythm, that will be either ventricular fibrillation or pulseless ventricular tachycardia. Some AEDs will charge themselves and shock on their own, but in most hospitals, it's a manual AED. They will expect you to interpret the rhythm, and if it's shockable, you will press the charge button, and before you press the defibrillate button, clear everyone from the patient and press to deliver the shock. Immediately resume CPR. If the AED reads asystole or pulses electrical activity, PEA, these are not shockable rhythms. Continue CPR. To wrap it up, everything that I've said specifically, make sure you know that you have to confirm the scene is safe before you intervene. Apply AEDs. Apply the AEDs as soon as you get the machine. Open up airway the head tilt chin lift method. And if the patient has any kind of neck trauma, use the jaw thrust method. Guys, common exam pitfalls: forgetting to check pulse or breathing within 10 seconds, pausing compressions too long for breaths or AED, incorrect compression depth or rate, or not prioritizing circulation fast in cardiac arrest. Remember, there are instances where you have to prioritize circulation, and cardiac arrest is one of them. Cardiac arrest, traumas that involves really large amount of bleeding, and during a triage, mass disaster triage. So those 3 things you will have to prioritize circulation first and not airway. Thank you for watching. Like, subscribe, and share my videos to show your support. Thank you and bye for now.